This is Michael, aged 34. As well as being homeless, he's got a long list of health problems. A form of Tourette's syndrome, damage from a stroke linked to previous drug use, now arthritis in most of his joints. But getting the healthcare you need isn't easy if you don't have an address.
When you want help, right, do you have to verbally scream and shout out, cry for help? Because that's what we're doing out here, mate. There's addicts and alcoholics out on the streets that want help and would like help. But it's hard getting that help.
Health experts talk about social risk factors, sleeping rough or in poor quality housing, having drug and alcohol problems and poor nutrition. Many of Britain's homeless have all of them. And one disease evolved specifically to exploit the most vulnerable: tuberculosis. Have you seen people with TB? Is it something you've come across, and is it?
Yeah, I've seen people coughing up blood and dying on the side of the road, man, because of TB. And it hurts me to see that and to know that's still going on.
This is barn door raging TB. This is TB is a disease that primarily affects the upper lobes. We're getting this sort of cloudy effect, and they're filling with this fluid and pus because there's an infection in there.
This chest x-ray is from a homeless woman who, now her TB has been diagnosed, will get the treatment that can cure her disease. But it wasn't taken in hospital. The clinic came to her. This mobile unit is the only one in the UK dedicated to screening homeless people for TB and other life-threatening conditions. And it's more important now than ever.
Rates have gone down a little bit in the last couple of years, but in the population that we serve, homeless people in particular, numbers have gone through the roof. Now, the symptoms of TB are cough, weight loss, night sweats, fever. Those symptoms are perfectly masked by the lifestyle that people experience on the street. So, delayed diagnosis, onward transmission, severe lung damage. So we are necessary to actually find people early and make sure that they can take their treatment.
Just stand with your chin on the ledge there, that's it. Your hands on your hip.
After proving successful in London, the NHS is now being asked to fund find and treat services like this in other major cities. They're busy over Christmas as other health facilities are closed. Homeless charity Crisis is also gearing up tonight to provide medical services at its outreach centres.
Some of the challenges we've got at the moment is increasing number of people who are homeless, and we're seeing that number increase. I live down in Brighton and Hove, and every week you see more and more people on the streets there. So it's actually the accessibility to services, and as a healthcare professional, it can be difficult many times. Actually, we haven't got the resources to meet everybody's needs.
The NHS is already planning for another difficult winter caring for the general population. Spare a thought for where that leaves those who don't have a home to go to.